I think physicians and nurses have been very interested in fact. And in multiple healthcare settings, we've had people contact us that work in emergency departments, inpatient hospitals, both medical and psychiatric. And I think nurses also pick up very quickly on fact. The contextual interview is really close in many ways to the way that nurses and physicians are often trained. And they just really are quick studies for this approach. And even in 15, 20 minutes, certainly in 3 or 4 hours, they're starting to integrate some important new concepts into their ways of working with people. I recall one study that I did with a medical student where we just did a 15-minute video and sent it out to physicians on using a bullseye metaphor with patients that were reporting problems with chronic pain. And they learned this metaphor, through a video clip, and then we assessed several months later, and many of them were using it, and they felt they could do it in 7 to 9 minutes. And one of the things they said that was really awesome was well, the thing they liked most about using the FACT approach was talking to their patients about their values. That's nice to think that we could encourage that kind of connections. Very briefly, Kirk, would you step in?
I think a lot of the concepts of FACT are in the common culture. They aren't esoteric. They aren't highfalutin. Most people live their lives according to these principles, or they try to. And so when you have them reflect on how this might be useful in discussions with medical patients, it's immediately obvious to them. And I think it's important to remember FACT basically got developed in primary care, in healthcare contexts. And when you're in healthcare, you work on a team. Your team members have to understand what you're doing and why and how to support it. So we wouldn't have exited out of primary care in one piece with FACT if we couldn't get over that bar that, nurses, nursing assistants, physicians of all training backgrounds can understand these principles and they can articulate them during medical visits. So yes, it's definitely a very potent model that could be used to expand the reach of behavioral health interventions by including people in healthcare settings who don't have necessarily mental health training, but they do mental health work all the time with their patients.
Absolutely. And I think, another thing FACT does for medical providers in general is help them kind of go beyond kind of some of their training that kind of led them into a way of helping people by eliminating problems. And that doesn't work for a lot of things that people bring to physicians and nurses. These are not problems that they can fix or cure or make go away. So it really gives them new things to use instead, new skills.
Join Dr. Strosahl and Dr. Robinson for applied FACT training. Sign up via Eventbrite using the link in the video description. Alternatively, for more information, visit actnow.co through the website link, also available in the description below.